Hi everyone, this is Dr. Pravinyas Patil here. Today I am demonstrating a clinical examination method called the Thompson test. The calf musculature of the muscle triceps group include the gastrocnemius muscle, soleus muscles and plantaris muscles. So together it forms the Achilles tendon. So any tear in the Achilles tendon will reduce the plantar flexion on the squeezing of the calf. The patient lies on the prone with his foot over the end of the table. The examiner squeezes the calf, specifically the gastrocnemius soleus complex. So squeezing of these muscles should cause the contraction of Achilles tendon, which lead into plantar flexion. So this is a patient who underwent the Achilles repair actually on his left Achilles tear. So after removing the suture, he is able to do properly the plantar flexion. So this shows a proper repairing of the tendon. If there is any tear torn in the Achilles tendon, then there will be no any apparent plantar flexion. In case of chronic complete rupture or the partial Achilles tendon rupture, plantar flexion will get minimized. But here we can see very good plantar flexion. So this is after the repair of Achilles tendon. Thanks for watching the video.